So that brings me to my last presenter, Debbie Langridge, who is going to twist a little bit and go to consumer perspective. And Debbie has worked in the public health and prevention space at all levels of government, federal, state, and local, and not-for-profit sectors to contribute to the health and well-being of communities. She has worked to capture the voices of all parts of community, including access and inclusion, Aboriginal and Torres Strait Islander people, cultural and linguistically diverse communities, children and young people, mental health, health, and community services. You're welcome, Debbie.
Well, I'm amazed at the number of people still in this room, so I've got to say thank you. I'm lucky last. I got the graveyard shift and the last presentation. So I think by looking around the room, and no judgment here, you're either incredibly passionate people who want to know as much as they can about COVID and research, and or you're really keen about the end of conference networking drinks, which are going to come pretty soon. So either way, thanks for being here. If I just, before I start, I'd just like to acknowledge the traditional custodians throughout Western Australia and their continuing connection to the land, water and communities, and to pay respects to all members of Aboriginal communities and their culture, and to elders past and present. Thanks for the introduction, Susan, and I have the privilege of being the head of the Consumer and Community Involvement Program, or the CCI program. We're a platform of the WAHTN, and we're also a member of the COVID-19 research collaboration that has been expanded and spoken about a lot today throughout the day. So, but we don't do research. So why were we involved in the research collaboration? Well, the Consumer and Community Involvement Program supports consumers and community members and researchers to work in partnership, so to collaborate, to make decisions about health research priorities, policies and practice. We improve lives by ensuring that the community's voice is heard and understood and applied in health research. And we come to work every day to enable involvement in health research by supporting and connecting community with researchers, with our partners, and with policymakers and everyone in between. So that's kind of the brief about what we do. Before I talk about the drive that Jonathan's talked about, but also that we've seen in this last 12 months about the WA community wanting to get involved in research as a result of COVID, I wanted to share some voices from researchers. Now, they're not cute, gorgeous kids like Jonathan showed earlier, but they're amazing researchers. And I wanted to use their voices to be able to tell you and explain to you why involvement in research by people with lived experience is so important and what it looks like, but also to give a bit of a lens as to why it was so important during COVID.
In the type of research that my team and I do, which is basically testing different exercise prescriptions in different cancers, we have the involvement of consumers right from the initial design of the study. And of course, in applying for funding, the funding bodies want to know that the research that you're proposing is actually important to people in the real world.
I think it's really important to have people like myself and other young people involved in the research, not just as participants, but in the development of the research, because it isn't really possible to actually conduct research effectively with a group of people unless you actually engage those people directly, make sure their voices are heard and you can understand what they do and they don't want.
Any kind of research needs to be translated into something real in community or in the research space or whatever. We always ask ourselves, so what? That's where the translational part comes in, and that's where the consumer involvement comes in. And what is important with that is really that you have the consumers driving the research rather than us researchers driving the research, and then I have the token consumer at the very end, see what we're going to do with this.
Yeah, so involvement is a real genuine two-way sort of dialogue between researchers and consumers and the community in terms of input into various aspects of the research. So from sort of its conception all the way through to communicating it to the public.
So we believe that consumer involvement in the research is imperative because it provides a means to ground ourselves in the community and what is important to the community, but also to translate our research into benefits for the community.
We put out an expression of interest through the CCI program for someone who had lived experience of mental health to join our team right at the very beginning. So Carly came on as a research buddy, and I learnt so many things from her. She has transformed the research project for our team. And I think one of the other things that Carly has really added to the team is this aspect of championing the research, and then she'll be pivotal in disseminating it into the workforce.
Working with a consumer advocate has made the process seamless for us. It's made it more efficient, more effective, and really has opened our eyes to how we can get more of our consumers involved in our research.
Consumers have been involved both in terms of informing the research that we do, deciding what were the priorities for research, but not only that, also informing how we do the research as well. So we want to make sure that the research that we do is relevant and meaningful and understandable.
So the CCI program has been beneficial in being able to guide us in the appropriate ways of getting hold of the community, structuring the community conversation that we undertook and facilitating that on the day.
The one thing I want people to understand around CCI, it's so easy. It's so easy, and you just miss an opportunity if you don't do it, you know. Talk to them, because there's so many good consumers out there that can help your research getting translated into real life.
So hopefully that gave you a bit of a context in terms of why involvement in research is important, but especially during COVID-19, there was so much, and we've heard that all day today, about so much that we didn't know. And so it was really important, we found more and more, to be able to share the community's point of view on and their thoughts about COVID, but also especially relating to research. So we saw a drive from the community, from the WA community generally, to want to be involved in research, unlike we had ever seen before. And so I just want to be able to talk a little bit more about these 4 things, which really, as Sean was talking about before the break, were really the silver lining, if you're allowed to say that, for COVID, because it brought consumers and people with lived experience into the research environment in a really strong way. So what did we experience? We saw a rise in the number of people not only wanting to know about research, and I think absolutely Jonathan being the most Googled person in terms of on Facebook and on Facebook with Telethon Kids, absolutely allowed people to understand that there was research going on. But the Flowon Effect that we saw was that people wanted to be involved. They understood, they wanted to do something about it. COVID affected everybody, and that's what a pandemic does, but it affected everybody so much so that their first response was absolutely Dr. Google. What is it? What's the treatment? How can I be involved? What should I do? The Flowon Effect for us in the CCI program was for us to be able to be sharing much more about how people could be involved, what it looked like, and especially that led to us establishing a COVID-19 community representative pool, where we had amazing people wanting to getting in touch with us and wanting to be connected with research projects. And there's some of those members have been here today, which has been fantastic. And then we had to do, as a flow-on effect, build knowledge and capacity of not only community members, but also of researchers, because involvement in research was becoming much more important. Secondly, apart from that growing awareness in the community, we saw a shift from the Department of Health in terms of consumer and community involvement in research grant applications and funding processes. And Darren Gibson talked about that earlier today. So there was the embedding of CCI criteria in the COVID-19 grants application process. That then allowed us to connect this amazing group of people, our representative pool, with researchers and health service providers who very quickly, again we heard about that this morning, those grants came out and went out to people with a very quick turnaround. So we were able to connect researchers with community members who were able to give a point of view, not only about the research, the co-design and the research topic, but also its implementation and the translation of the detail afterwards. We also saw representation on grant review panels, which was a very strong indication from the department that it was becoming more than just the, makes you feel warm and fuzzy kind of experience. And these things have now led to long-term changes and long-term platforms within the Department of Health with the FHRI fund grant process. Firstly with review panels, expressions of interest. Again, Darren mentioned this morning that they've got over 100 expressions of interest for people with lived experience to be on grant review panels for the FHRI fund application process. And the second is that there is now, again, an embedded criteria in that fund grant process. At the moment, it exists where applicants need to name a consumers that they've been working with in terms of coming up with the research concept, the design, and then the process of the grant. But this is only a first step, really, towards requiring what will come to be at least one consumer as an associate investigator on applications moving forward. So it's a watch this space environment of which we're really excited about because we see that it makes a difference in research, but also it's a flow-on effect from that growing awareness of community wanting to be involved in research and for researchers seeing that it makes a difference, which is, obviously that's why our program exists. Lastly, I just wanted to mention something that we hadn't done before, but COVID really brought it to our attention. Again, it was because of the unknowns that were out there. And specifically, members of the team were having conversations with ED teams in some of the hospitals, and their need to know if there is going to be a pandemic, what do people expect? What are the community's expectations about COVID positive patients arriving in ED and the processes that should be there, but also especially about consent, where trials and treatments were unknown, processes in terms of just the fact that PPE changed the way that conversations about consent and research possibly were going to change. And so we put together a survey of informed consumers. So we worked with the COVID representative pool that we had, but also members of Health Consumers Council WA who had been informed and involved in research. So we worked with those people. There were 210 people that were involved in this survey to give information about the accepted form of consent and process during a pandemic specifically. It was unknown. The survey actually, if you're interested in the results, it can be found on our website. But what did we find? We firstly found overwhelmingly so that people wanted to be involved in research, and that research was so important during a pandemic and during the COVID pandemic, but also that people, that they had points of view about the process moving forward. So there were absolutely informed ideas about relating to consent and also about the process that we asked feedback on. That information, fortunately, didn't need to be implemented because we weren't ever put into a pandemic where ED looked very different to what it currently does now. But overwhelmingly what we found was that there is a sense that community needs to be involved in terms of finding out where there is unknown about processes and or research about what that process within an ED situation where there's an urgency, what consent should look like and what it shouldn't look like, also at the same point of view. So just to finish off, given the drive that we've seen, and we continue to see, but especially in this last 12 months, from community members who really, unless they had a diagnosis themselves, weren't really knowing a lot about the research sector. So that's been a great change that we've seen. But it's something that we've got to continue to now put in next steps. Again, it's that silver lining that we need to engage and capture and build on. Next steps actually involve everybody in the room and everyone in the research sector. Firstly, for us as a CCI program, our job is to connect people, so is to get great people with specific lived experiences and to connect them with researchers. That's what we do. So that's important for us to continue to do that. Training and support is essential, and that video is one of a series of 4 that shares what CCI in research looks like and helps support the reason why it's important. Training and support we do not just with communities but with researchers, with organisations, institutions across the board. Sharing with the community about research, and Jonathan gave a brilliant example of the way in which telethon kids are doing that in a tremendous way. Research is becoming, a great point of conversation, and people are finding out more. A lot of the people that we engage with every day don't know much about the research that is going on, the research that you're doing in this room, that being here in this room. So we all have a part to play. We've all got family, friends, and everybody else. Make it a conversation, as in terms of the importance of it, but also the way that people can get involved. And lastly, there's a need to continue to embed CCI in the research process. It's becoming something that is recognised as an essential element, and so it's something for the CCI program we're here to support. So just to finish, I just want to encourage you to get in touch with us, but also if you're a researcher, to just recall those voices of the researchers in that video, because they're the reasons why you should be doing what you should be adding, if you're a researcher, to what you're currently doing. But also, we've found that in this last 12 months that CCI in research is not only wanted, it's needed, and it can be supported. So there's no reason to not be doing it. So yeah, thanks for your time.
Debbie, there are questions for Debbie? Welcome.
Yeah, thanks.
So my experience with the consumer and the community revolves around my tennis club.
Great.
I get a lot of questions.
Think of all the people that you can talk to, George. That's awesome.
So the COVID thing has raised considerable awareness, and it occurred to me that we should we have an obligation to inform the community and the consumers so that they can better even help us further with knowledge. So I get questions like, why do I have to get the immunization? Why can't I get the COVID virus naturally, right? These kinds of questions. And won't this RNA vaccine change my DNA? So I've been doing sort of molecular biology 101 in my tennis club. But I just wonder whether there is some mechanism by which we can just increase the awareness of the scientific method in our community so that people just appreciate how powerful science is, how empowering it is. Is there some way we can do this?
Absolutely, and I think it comes to, as individuals in the room, there is a responsibility. As I said before, the way that telethon kids are sharing not only what they're doing, but how it should be an everyday thing, because as you say, George, it is impacting in so many different ways. CCI program is here to work and support with as many people that we can work with. We'd love to raise it another level, but we need dollars because we're independent and don't have the funds. So you could give us some of your money, George. That'd be fantastic. We're just down the hallway from each other, so maybe we should have a coffee and do that. But yes, there is, and I think we are really keen to be working with our universities and medical institutions that that we're working and partnering with for us to be able to help their comms teams to be sharing what is currently going on. At the business breakfast yesterday morning, it was a great suggestion from one of our panellists, and she's just up the back there, of how many people have sat in a clinic in the Department of Health in a hospital, either as a carer or as a patient, and there are television screens or notice boards around. There's a mechanism in itself, a captive audience, to be able to be telling people, you know what, there are ways that you can be contributing to research not just as a participant, but as getting involved, and that's where the difference between involvement and participation is also important. So I'd love, absolutely, I know after yesterday morning's breakfast, a few people kind of suggested that we run a session and have a brainstorming session. There are amazing minds even in this room. And maybe, if people see me coming, I know they'll probably run the other way during drinks. But it absolutely is about a collective agreement because we all benefit, absolutely.
Yeah. Thank you.
Thanks, George. Oh.
Okay.
Obviously today's been all about COVID. What impact has all the money and all the research that's been happening on the COVID area had on the other areas of research that normally CCI would be involved in? What's the impact been?
We haven't seen a significant change fortunately, in the number of research projects that are wanting us to support them in terms of involvement. So it doesn't matter whether or not, we haven't seen a change per se in that there's been a shift to people only wanting to be involved in COVID as opposed to cancer or diabetes or MS. So fortunately, if anything, we've actually seen people having a genuine understanding that it doesn't have to be specific about COVID, and that light bulb moment where people go, I had no idea that I could be involved in research. I don't have, I'm not a doctor, I'm not a professor, but guess what? We're all experts in our own lives, and that's all people need to be involved. So fortunately, I think it's been a good thing that we've seen that. So yeah. Requests from support to be involved in research. Yeah, look, it hasn't been just specific for COVID, but usually it depends on what grant application process is coming up. So when there is with the COVID grants, and that short timeline, that was a big focus. Absolutely, that's usually the stimulus with researchers that we find that they desperately need some help, and so therefore that's where the COVID, the representative pool, and that you were on, was really helpful because there was an audience of people to connect with. But yeah, I'd love to see it. I'd love to see us be inundated tomorrow. That would be fantastic. So yeah, thanks.